All right. Well, good afternoon or morning, depending on where you're at today. This is Brandon Garrett with the National Minority Quality Forum. I am pleased today to have Dr. Anita Burgos with us, or Burgos with us today. She is obviously, you may know her. She is with Congresswoman Kelly. She is a neuroscientist by training. She trained at Columbia University, did her undergraduate at NYU in neuroscience. So she practiced in neuroscience now she's on the policy side of things. You may recognize her as well as because Dr. Burgos she led our first bilingual webinar about 2 months ago. Is that right, Anita? Dr. Burgos?
Yeah, that's
Yes.
right.
So it's our first bilingual webinar. But before I kick it off to her, I just want to start off. We haven't done one of these in a while, and I just wanted to set the conversation. I want to do a poll question. And in this poll question, I want to know, do you plan on getting the COVID booster shot? Yes, you've received it, not yet, no, or I'm undecided. So just let us know your thoughts there. We'll give you about a couple of minutes before we finish it and before we close it. And at this time, I'd like to turn it over to Dr. Burgos just for a brief introduction. Tell us a little bit more about yourself and what brings you here today.
Yeah, no, I think that kind of covers it. I'm really excited to be here today because there's a lot going on the Hill. Many of you know, Build Back Better. There's supposed to be a vote on the House on it today, both that and the bipartisan infrastructure package bill. So there's a lot of flurry, a lot of excitement. So I want to talk today a little bit about what went into Build Back Better and how that's going to be really exciting and create a lot of changes in the healthcare system, especially for communities of color. But then I also want to talk about future legislation. So I want to talk about the Health Equity and Accountability Act and other exciting work. We're beginning to really work on that bill as a tri-caucus and want to talk a little bit more about that. So present and future is what we're going to cover here today.
All right, I appreciate that. And you all know, everybody on this call knows that I'm a huge fan of Congresswoman Kelly and the work that she does and the work that the team does. So I really appreciate you being here today. But first, Keiko, can we get the poll results? All right, so our audience, about half of you have received it, and then another 43% have not yet received it, but you plan on it. Only one person is a no and one person is undecided. So that probably explains our sort of region in DC and our community. Just going ahead and start, you mentioned you started off talking about Build Back Better and what's in it. What are some provisions in it on the healthcare side of things that sort of does Build Back Better?
Yeah, the bill is enormous. So I think now the current version is about 2,000 pages. So there's a lot in there. A lot of really big democratic priorities are in there. And so we're really excited. And so I want to talk, I could talk a lot about, we could have a whole session just on Build Back Better, but I want to highlight some of the provisions that Congresswoman Kelly has really been fighting for as the chair of the CBC Health Brain Trust. So one of the things that she's been really fighting for is expanding healthcare coverage, especially for those who fall in the Medicaid coverage gap. So what I mean by that is folks who are in those 12 states who did not expand Medicaid, but would be otherwise eligible. And so they've really fallen through the cracks. A lot of them are in the South and in rural areas. And so the Congresswoman really saw this as an equity issue because 60% of those folks who are in the coverage gap are people of color. And as I mentioned, there's a lot of geographic diversity. So folks are also in rural areas and don't really have access to care. So the Congresswoman really wanted to make sure that policies to close the Medicaid coverage gap were included in Build Back Better, and they are. So at this point, there's a couple of different provisions, but the main gist of it is that individuals who are in those 12 states will be able to go to the ACA marketplace and access a Medicaid-like plan on the marketplace, and that will be able to meet a lot of their physical and mental health needs through those plans. So that's extremely exciting and a really big win for Democrats and for Congresswoman Kelly. Another thing that is almost synonymous with Congresswoman Kelly is maternal health and trying to combat the maternal mortality crisis. So as many of you I'm sure know, the maternal mortality crisis disproportionately impacts Black and Indigenous women in this country. Black women are 3 to 4 times more likely to become a maternal mortality statistic statistic than non-Hispanic white women. And so one of the big provisions in Build Back Better, Build Big because it's important to us, is extending Medicaid postpartum coverage. And this is a provision that is in the Congresswoman's very comprehensive Mama's Act. So this is a big win for her and a big win for all new mothers, really, because what this policy or investment would do is currently, if you're a new mom on Medicaid, you only have Medicaid for 60 days and then you're done, right? You're kicked off. And this is during a time when you're most vulnerable to mental health conditions, to physical health conditions. You really need that care. And often moms are going to get care for their babies, but don't have actual insurance themselves. So this provision would extend Medicaid postpartum coverage from 60 days to 1 entire year. And experts say that this can help to really eliminate or greatly reduce the maternal mortality crisis in this country. So it's a huge win. And this would be a permanent policy. So all states would be required, mandatory and permanent, all states would be required to cover new moms for up to 1 year. So very, very exciting stuff. There's also about $1 billion in Build Back Better to invest in maternal health. So things like addressing social determinants of health, perinatal workforce, such as doulas, and maternal mental health and substance use disorder services. So that's a big one. And there's one other thing I wanted to kind of touch on. It's not maybe like the sexiest thing that people are talking about, but I did want to mention that there are quite a bit of investments in mental health in the bill. As some of you might know, the Congresswoman's Fall Brain Trust with the Congressional Black Caucus Foundation's annual legislative conference focused on mental health. And so it is something that is top of mind for the Congresswoman and for the Health Brain Trust. And so as you may know, treatment in the United States for both substance use disorder and mental health is actually really low. So for mental health, for people who need mental health care, only 50% of those actually get care. And for substance use disorder, it's 10%. Only 10% of people who have substance use disorder actually get the services that they need. That's abysmal. So the Build Back Better Act would have investments to bolster mental health treatment by allowing states to cover what's called certified community behavioral health clinics, just going to give more resources to mental health clinics. Would give options for covering mobile crisis services, which can be really helpful for folks who are facing acute need. And huge investments in addressing behavioral health needs in communities of color specifically, including training the future generation of mental health providers through the SAMHSA Minority Fellowship Program. So some really good stuff there. And of course, there are all the policies that you've probably been hearing about, such as other things that would help expand access to care. So we have making permanent the enhanced ACA subsidies in the marketplace. We have Medicare hearing. So now there will be a new benefit that would cover hearing aids and certain auditory services under Medicare, which would be really great. And finally, the drug pricing reform. There's a lot of stuff in there on making drugs more affordable for folks. And so all of that and more is in the Build Back Better, but those are just some of the things that I wanted to start us off with.
Wow. So when I heard you, I heard a lot of great things. The last point you made, just access to care. I know that's something that we all have been fighting for a long time. And then the Medicaid expansion. I don't think many people realize how many people of color live in those states in the Southeast, especially, that are, almost like at Fort Mississippi and at 30% plus African Americans alone, much less the entire, all people of color. And so that seems like a lot of work. I guess that's why I was checking out the Congresswoman's. I'm not a Gen Z or anything like that, but I was checking out her Instagram page earlier today, and I noticed she had written something. Essentially, she said, "If Democrats want to keep our majority, we need to be taking our Build Back Better message farther, harder, and longer than before." So you talk to the Congresswoman. What do you think she means by that?
Yeah, so I think that can mean a couple of different things, right? So it means kind of within the Democratic Party, we need to get our stuff together and really pass this bill. Like it's time.
Agreed.
There's a lot of good stuff in there, and so I think we're getting to a better place. But of course, there is a lot of negotiation that went into this bill, and I think that we're close to passing it, so we should just go for it. So I think that's part of it, but also what's part of it is at the end, right? So when we pass this bill into law, we need to do a good job to really message on what is in this bill, really tell the American people why this bill is so great and all the wonderful investments that have been made into the healthcare system, and to really start eliminating some of these health inequities. There's some huge investments, and President Biden has really made equity really put that at the forefront of his presidency and for his administration. And so that is reflected in this bill. And so just making sure that we're getting that message out there, that we're not being shy, that we're really letting people know all of the wonderful things that are in here, so people can make that connection between the bill, the bill and the good things that are in there, and the changes they're seeing in their everyday lives, and the Democrats who fought so hard for those things, even fighting amongst ourselves, really trying to make sure we have like the best possible policy to put forth.
Right. Yeah, and I like my friends, or my young friends say it with your chest, be proud of all the work that you've done,
It's been a lot of work. So.
Yeah. And you mentioned this like very comprehensive 2000 plus page Build Back Better bill. But I think one of our questions that we received online sort of leads into my next question, right? We have this big comprehensive bill, but it can't take care of everything. And I know you are working on a lot of other things. One in particular is the Health Equity and Accountability Act. And would you mind just giving us a quick background on Heaa, and then just some of the things that you want to start working on with that legislation?
Yeah. And we've been partnering together on that bill. So we've been partnering with the National Minority Quality Forum and the National Urban League on that. They've been sort of our external partners and gathering all the stakeholders, making sure that the stakeholder voice is really reflected in Heaa. So that's really exciting. But what is Heaa? So this bill was first introduced in 2007 and has been introduced by the Congressional Tri-Caucus every Congress ever since. So then every Congress, one of the tri-caucuses takes the lead. So last year it was the Congressional Hispanic Caucus. This year it's the Congressional Black Caucus, and next year will be CAPAC, the Congressional Asian Pacific American Caucus. So it's a really wonderful effort and huge collaboration between the tri-caucuses. And really this bill is the only legislation that directly addresses the intersection of health inequities, immigration status, age, disability, sex, gender, sexual orientation, gender identity and expression, language, and socioeconomic status. So all of these things intersect and interact. And this bill does a really great job at trying to meet policy that really fits the need of all those intersectional needs. And so the bill is a very comprehensive bill as well, and it would help to advance health equity. So not everything, although Build Back Better has a lot of really great investments in it, there's still a lot more work to be done, right? Health inequities have been taking place for centuries in this country, and we're not going to get it fixed with one bill. So this bill is sort of takes us to the next step, and every year we add new things to it, and it's really keeping it fresh and keeping it really relevant to the current moment. So really excited to be working on that. And just to touch on some things that the bill addresses. So the bill focuses on things like data collection and reporting, specific diseases that impact communities of color disproportionately. We focus on mental health, substance use disorder, social determinants of health, really all encompassing. So there are 10 titles, and then they really touch on a lot of the key things that have become really, a lot more members are talking about, and a lot more stakeholders are talking about health equity. And so we're really excited to introduce the bill this Congress.
Yeah. And I just wanted to focus a little bit on the mental health space, just because I know your background as a neuroscientist here, and it's great to have you as a practitioner and a policymaker in this space. What are some things that you would like to see and it may not even Heaa, but I'm going to the doctor part of Anita Burgos. Like, what things do you want to see through all your research that just would be very helpful to just the American communities of color in the mental health space?
Yeah, that's a great question. And one I think about often. And so I think one thing that is really key when we think about mental health is how to integrate it into existing systems in the healthcare universe, right? So So people go to primary care to get their healthcare needs. So how do we meet people where they are? If they're going to their primary care physician, how can we integrate more behavioral health services? So behavioral health, meaning mental health and substance use disorder services, into places where people are already showing up, right? If there are community healthcare workers in working with the community, or promotoras, which are sort of like the Spanish-speaking community healthcare workers, how do we empower those individuals with mental health, sort of training them to provide mental health interventions when they're already such a touch point in the community. So really trying to meet people where they are, I think, is the biggest thing that we can do. And really the main way to do that is by not investing, but making changes to Medicare and Medicaid kind of structures that already are so present in our healthcare system, and really making sure, providing some accountability for mental health needs to be met in these spaces that we're talking about, including primary care. So I think aside from making some much needed investments in the mental health care community, something else that's really important is that we change the way that we're paying for services, such as incorporating more value-based payments, and also provide some more accountability through reporting and quality measures that really reflect this integrated care, because separating the head from the rest of the body just doesn't make any sense, like especially when they interact so much with each other,
right?
And especially when mental health and chronic issues go hand in hand so often. So just making a more integrated system, I think, is like the number one recommendation I would have. And also integrating care has been shown to be very effective for communities of color, especially because when you have an interdisciplinary team, you can have a Spanish-speaking social worker on the team, or a Chinese-speaking social worker, or sort of you can include a little bit more of that language accessibility piece when you have an interdisciplinary integrated team working together.
Right. So it's like the community can help care for, in a sense.
Yeah. Everyone kind of can have a role to play, and especially if they keep the lines of communication open and everyone kind of knows they're on the same page about the patient.
Got it. Just bringing it a little bit back to the HEAA, or Health Equity and Accountability Act legislation. And please, if keep going in, I'm in DC, so DC speak always happens. So if I need to, spell out every acronym, I will. But the HEAA legislation, it's done a lot in the past, right? I know that it's not a bill that, it's comprehensive and big, but everything doesn't always this doesn't get past whole. But what are some pieces in the past that HEAA has contributed to? What are some sort of highlights of the legislation since 2007?
Yeah, so that's a great question. And I think it's important to note for the stakeholders on the call and other people who are really invested in Heaa is that Heaa, the goal isn't necessarily to pass Heaa completely as a bill. It is also about 1,600 pages, so it's a very large bill. And although we would love to have every provision in there passed at the same time, what's more likely is that pieces of Heaa will be incorporated into other bills. And so this has already happened a few times, and one of the most notable times is with the ACA. So parts of Heaa were actually included in the ACA, and so there were parts including requiring race, ethnicity, language to be reported in HHS funding, elevating the Office of Minority Health to the Office of the Secretary of HHS, and creating new offices of minority health across HHS agencies such as CDC, HRSA, and SAMHSA. So those are just a couple of the wins that we got into the ACA. But even more recently, one thing that got incorporated from Heaa is making clinical trials a little bit more diverse by trying to include more Medicaid beneficiaries, making it easier for Medicaid beneficiaries who are often from communities of color and might be those folks who are not as well represented in clinical trials. So some of those provisions have been recently included in bills that were passed at the beginning of this year. So that is probably one of the more recent wins.
Yeah, I know that that's a priority, I believe, of Congresswoman Kelly, but as well as I think, is it the Health Subcommittee Chair Eshoo? Is that right?
That's right. Yeah.
Could you tell us a little bit since I'm assuming you're likely to include some of that in HEAA, could you tell us a little bit about the clinical trials legislation you're doing and the hopes that you have for it?
Yeah, absolutely. So where the Congresswoman is working on two bills, actually. So she's working on a bill that she's been leading along with Representatives Cardenas, Butterfield and Clark. And so this bill would focus more on the NIH side of things. So NIH provides a lot of funding for clinical trials. And so they have a lever there to really provide a bit more accountability for clinical trials as they are sort of designing their trial and thinking about how they want to keep their trials more diverse. So currently, NIH obviously is very committed to clinical trial diversity, but there isn't really there aren't clear and measurable goals that are established in the application at the beginning of the application process. So the bill that we're working on really empower NIH to work with their sponsors to design these clear and measurable goals and standards so that NIH kind of knows what to expect and the clinical trial sponsor knows what to expect. And of course, these standards will vary depending on the disease or condition that's being studied in the clinical trial, right? There are some diseases that disproportionately impact communities of color. We want to see a bigger number of those folks in the clinical trials, but there are others that may not. And so we want to be flexible kind of in that way. So there would be clinical trial diversity standards. There would be needs-based assistance. NIH will work with sponsors to provide and international regulatory review boards to provide needs-based assistance to folks who need it because for missing salary or transportation or whatever, and for them to kind of overcome some barriers that are keeping them from joining the clinical trials. Another part of the bill would start a public awareness campaign with HHS, FDA, and a ton of other agencies to really get the word out to physicians, to get the word out to people that we want, there is an important need for clinical trial diversity.
Right. Especially as we go more into precision medicine and whatnot, as we make things more specific to somebody's DNA, we definitely need to do that. And so you mentioned I believe and then you had another piece of legislation you're working on.
Yeah, thanks for reminding me. I forgot to talk about that. So, so we're also partnering with Representative Eshu, who is the chairwoman of the Health Subcommittee on ENC. And so her bill focuses more on FDA, right? And so FDA has to also submit an application before it tests a new drug in a clinical trial, it has to submit an application to the FDA, right? And so what are the diversity standards kind of from that perspective that FDA is working with clinical trial sponsors to develop? And so then the SU bill would focus more on sort of the FDA side. And there are also a couple of other provisions to help increase clinical trial diversity that are not within the FDA, but sort of how we have that public awareness piece. They also have a couple of other pieces to help get the word out.
Got it. So we have all these like big pieces of legislation and the whatnot. When do you plan on introducing Heaa? What's your process there? When can we see this 1,600 page?
So the bill would be introduced. The plan is to introduce it in April 2022 to align with two things. The first is with National Minority Health Month. And the second is to align with the Spring Health Brain Trust that we do in collaboration with NMQF. So that is kind of a hard deadline. And we're working with stakeholders to really meet those deadlines. And we're going through the bill title by title, getting edits from stakeholders, getting edits from the staff here on the Hill. It's a very collaborative process. And so if anyone here on the call is interested in participating more in Heaa, please reach out to Brandon or myself, and I can throw my, I don't know if I can throw my
Keiko can add it to it.
Okay, yeah, Keiko can add it to the chat. Yeah, so you can reach out to either of us if your organization or if you have any thoughts on Heaa, and we can link you up with the working group if that's something that you're interested in.
Right. So sounds like you've been pretty busy, to say the least. I'm gonna give Anita a break. Keiko, I think we have another poll question that we want to ask, and just a couple of quick housekeeping announcements. One, you have the chat section over here, so I love the engagement that's happening over here. But if you have any questions that you would like to have for Dr. Burgos or myself, please put it in the Q&A box below. All right. And then the next question, Are there plans for children in your family between 5 and 11 years old to get the COVID vaccine? You know, we just got approval for that. So are you going to have your kid take the vaccine? If it, so just let us know. I don't have kids yet, so I don't think I can answer that question, but my guy kids, sure. All right. Before we get the answer to this one, the answer to that survey, I just have another more questions for you. Sorry, you're in the hot seat today, so I apologize. But so as we talked about Build Back Better, we talked about HEAA, we talked about all these other things. What would be the impact of Build Back Better legislation on funding for the Affordable Care Act and Medicare as we continue to also work with those pieces of those laws as well?
Yeah. So as I mentioned, in terms of the ACA, there are at least two big changes that are taking place. So the first is that is how folks who are in the Medicaid coverage gap will receive plans, will be able to access plans that will cover their needs. It's sort of a Medicaid-like plan. It's not actually going to be Medicaid, but they're going to be no copays or minimal copays, no deductibles, no premiums. So in many ways, it will reflect kind of the Medicaid plan. And there will also be, as I mentioned, made permanent these enhanced ACA subsidies. So, you know, on the marketplace, you can access premium tax credits and cost sharing reductions. And so at least with the premium tax credits, the number of folks who are eligible for those credits the eligibility has expanded. And that happened through the American Rescue Plan. And so these changes are now going to be made permanent because so many people saved hundreds of dollars on their premiums. And so, and increase the number of $0 premiums that were available. So now that will be made permanent, which is really exciting.
Got it. All right, and let's see the results of the poll question. Let's see what people are doing. All right, little less about, well, no, 65% of folks say they're gonna go ahead and have their kids take the vaccine, and then 30% are not, and about 5% are undecided. So it's interesting. That's interesting. I would I have friends that are both sides of it. Like, I just need to get out, and so I need my kid to get vaccinated because my kid is the one that typically gets sick in this house versus because, you know, you go to nurseries and elementary schools and whatnot. Kids don't know how to social distance, so they don't know how to wear the mask all day. So they're getting better. They're better than my generation was, I'm certain. So we had a question here. I'm not certain, this may be a little bit outside, but I'll just go ahead and ask it from Mr. Jones. Build Back Better and HEAA are large pieces of legislation. How will this legislation prevent supply chain issues to improve climate conditions, specifically in the US and likely around the world?
Yeah.
You can go ahead.
Yeah, that's not something that I've been following very closely. I've been focused mostly on the healthcare stuff, so not as clear on the supply chain issues.
Right. Same here. So Mr. Jones, if you would, I will take the question and email it, respond to you at a later date with some better information on it, because I need to do a little bit of research. We've been very healthcare focused with this piece of legislation. So is there we talk a lot about the things that we're doing on these bills and these policies and whatnot. What do you know of anything that are you hearing anything that members of Congress are doing at the community level to sort of just get out there and go out and help get folks vaccinated or get folks better access to care? Is there anything that the Congresswoman is doing right now? Are you hearing other members of Congress doing to sort of just be boots on the ground and getting things done?
Yeah, I think it varies member by member. I think they're kind of on the district side. There are efforts taking place. I know at least with Congresswoman Kelly, she had a Black Women and Girls Symposium a few months ago. And at that symposium, she had someone there, kind of a vaccine station to provide free vaccines for folks who wanted them. So I know that's taking place. I know that
a little bit of technical difficulties here. We'll give it a second for Dr. Okay, there you go.
Am I back?
Yeah, you're back. You're back.
Okay, good. Yeah, I've been having some internet issues lately. I'm not entirely sure why, but glad I'm back. And let me know if I cut out so that I don't keep talking.
Yeah, no worries, no worries. So yeah, we just heard about your Black women and girls. I think and you're gonna have some folks were able to get vaccinated at the event.
Yeah. So I don't think anyone actually got vaccinated, probably because they already were vaccinated, hopefully. But yes, we did offer that opportunity or sort of have that as an option for folks. And so I think meeting kind of people where they are and just having those places where they can go and receive a vaccine is important. Not aware sort of what other members are doing, but I imagine similar things are taking place in the district where they can kind of increase the opportunities for people to get vaccinated.
Yeah, and I know it's not just limited to members of Congress doing this or public officials. So, for example, I know that on this Sunday in DMV at Allen Chapel AME, they're hosting a community day and health fair tomorrow from 10 to 3. So it's if you're in the DC area, 2498 Alabama Avenue Southeast, they'll have COVID testing and vaccination and boosters, and it's all provided by 5 Medicine and Safeway. So we'd love to, if you know it, we'd love to pass that along because I don't know what percentage of the US population is right now that is vaccinated, but we're not at the overall goal. And so we're keep hearing about more variants and more people getting sick after. So it'd be great to make sure people continue to just sort of take care of their health and get vaccinated. All right. Would you have a number about like what percentage of folks are vaccinated right now, Dr. Burgos?
We just presented on this. You mean like in the country?
Yes.
Yeah, I don't have it off the top of my head, but I can in a few minutes. So we can keep talking and I'll pull it up.
All right. Yeah, I know that. And it's interesting. When I was traveling, and I'm in sort of the DC area, I feel much safer because I know that the majority of people it seems like the stats in DC, the majority of the people are vaccinated. But when I travel home, I'm home now in Louisiana, then I know that's not the case. So I feel a little unsettled in different places in the country. I mean, my family's from Louisiana and Miami. So when I had to go to Miami over a year ago, it was the scariest thing ever. At least I thought, because DC, we had to, 2 people in an elevator, masked all the time, whatnot. But if you go to another region of the country, the rules were much different. So
yeah, I was actually just in Miami a few weeks ago, and the vaccination rate isn't too bad. It was like almost close to 90, but I don't know if those were like CDC numbers. I just Googled it. So I'm not sure, but like the mask wearing wasn't a thing really there, but it seems like the vaccine rates were high. So that made me feel a little bit better, but yeah, people were comfortable for sure. So I did pull up the numbers. So this is from CDC, and actually I was surprised that Washington DC wasn't as high as I thought at least. So
same here.
Yeah, so for Washington DC, it was 62% are fully vaccinated and 74% are at least 1 dose vaccinated.
Okay.
So there's some protection. Not everyone's gotten the full like two doses. And I'm sure that probably changes depending on like what communities we're looking at. Right, so right. I wouldn't be surprised if there were some disparities in like who's getting vaccinated and who's not in DC at least.
Yeah. Is there, since this is a sort of, and I just wanted to comment that Miss Ringel, since like she believes the number is about 192 million total in the US.
Yes. And sorry, in total in the US, we have, the numbers change depending on what age group we're looking at. So ages 12 and up, it's 68% are fully vaccinated, 78 have at least 1 dose. And ages 18 and up, 69% fully vaccinated, 80% at least 1 dose, which seems kind of high actually.
Yeah.
Maybe I need to look at those. This is from the CDC, but that sounds crazy high.
Yeah.
And for age 65 and up, it says that it's 85% fully vaccinated and 97% at least 1 dose. Again, maybe not so surprising, but 97 is really high. So I'll double check that, but that's kind of what we presented for the office earlier this week.
Got it. And as this is vaccines, it's so interesting. Like they were talking about Governor DeSantis and not requiring the vaccines, but then just a year ago required all the vaccines for entry into school. Is there any thought of putting any vaccine provisions or research on vaccines in the HEAA legislation since you have the opportunity to do this huge bill?
Yeah, that's a good point. I wouldn't be surprised if that something like that would be included. Um, I know a lot of research, a lot of money has gone in over, like, I think in ARP and in
Mhm.
Build Back Better. I think there are probably some provisions relating to vaccine. So not sure kind of what else we want to do on top of that, but he is an excellent opportunity to look into that more.
Got it. And then we mentioned that if you had any community partners that were sort of interested in doing Heaa, uh, they're more than welcome to join us. And obviously, we at the NMQ, National Minority Quality Forum and the Urban League are participants in it. Are there any other particular groups that you just want to quickly highlight that's helping you with the legislation?
I would say those are probably the two major ones. I've been sort of thinking myself about groups who I want to make sure are involved, and encourage anyone on the call who either wants to be involved or knows of a group that should definitely be involved to reach out to either Brandon or I, because like we want to be really inclusive. This is a very inclusive bill, and we want to make sure that everyone's kind of participating who wants to be included.
All right. Well, great. I think we've said more than a mouthful, and I think all the policy wonks have gotten their fix for the day. I was just wondering, did you have ending a little early, but I just wondered, do you have any specific comments or just final closeout that you'd like to say?
I think, if healthcare is something you're interested in, which I'm guessing it is since you've tuned in here today, like take a good look at Build Back Better. And if there are things in there that are helping you or helping someone in your community or in your professional job, if you're a clinician, like really getting the word out about that, and letting people know kind of the impact that these bills have. I think outside of folks who are really plugged in, it can be hard to understand these big bills and what they mean for everyday people. So just like just making those messages really clear is something I want to leave everyone with. And of course, as I said, there's a lot of really, really exciting stuff happening on the Hill, but also we need to do more. So if you are interested in participating in Heaa in any way, or just have any thoughts for us, please reach out so that we can make sure that those thoughts are incorporated into the bill.
All right. Well, thank you so much, Dr. Burgos. I mean, it's just always so great to hear your expertise and to hear sort of a practitioner that's working in the policy space now and how you specifically approach dealing with legislation. Because I know you've sort of been in the clinics and all these spaces, but now you're in the halls of Congress writing it. So it's good to have you there. And I just also want to do a quick plug for next week's webinar to be led by our Vice President of Policy and Program, Gretchen Wortman. And they're going to talk about the introduction of two programs with NIH initiatives with Unite and the All of Us research program that we've been working on for some time. And like I said, if you have any, or like Anita said, Dr. Burgos said, it's important she earned that title. Please, if you have any questions or concerns or have any interest in working with us on HEAA or any policy questions, feel free to email us at the Office of Congresswoman Kelly or at the National Minority Quality Forum. And with that, I just wish everybody a good weekend. And last but not least, thank you to Keiko for always making sure that this happens.
Thank you.
All right. Everyone
All
have a good
right.
weekend. Bye,
Yeah,
folks.
have a good weekend. Bye.
Bye, Doc.